It's January 23, 2021. This is News 360. Good evening and welcome. My name is Aisha Yakubu.
And mine is Roland Walker. We'll now bring you our headlines for tonight.
Pupils and teachers of Agave Kindergarten and Primary School in Volta region risk contracting and spreading COVID-19 as they study without adhering to safety protocols.
We'll also bring you the story of how doctors at the Greater Accra Regional Hospital braved the odds to deliver a baby whose mother tested positive for COVID-19.
Aged 37, she was a patient with high-risk pregnancy, already complicated by uterine fibroids. Then she contracted COVID-19. Saving the lives of both mother and her precious baby was topmost priority. Her case was described by doctors at the Greater Accra Regional Hospital as a novel one, and for them, teamwork made the difference. Now, here's a story by Wendy and Anita Odei.
My husband started coughing. I thought it was a common cold because it came with phlegm. But they told us COVID was a dry cough, so I didn't suspect anything. But later in the night, I started having like really high fever. My temperature was elevated and I was sweating a lot. So I went to my gynae and then she advised me to go to Noguchi for a test. And then 2 days later, it came back positive. And then I went to Ghana East Municipal Hospital COVID unit. They realized my case, 40 weeks pregnant, was quite like a volatile situation. So they referred me to Greater Hospital Intensive Care COVID unit. They gave me so many medications and then oxygen. And it was really, really difficult. I thought I was going to die, seriously. I could barely walk for less than 5 minutes without gasping for breath. I saw a highly pregnant lady with COVID. They were really, really surprised. Pregnant woman with COVID at 40 weeks plus 5 days. So eventually after 5 days, the operation was scheduled around 6 o'clock. I thought I was going to die because I'm quite an energetic lady. And then I realized with the pregnancy, my immunity was really, really low. So I couldn't bear any of the symptoms at all. And that was when I realized, yes, this lady is really weak this time around. She assured me it wasn't going to affect the baby. So that gave me a little bit of reassurance. So the rest was for me to be able to fight and gain my strength and deliver the baby. But I realized at that moment I couldn't do it all by myself. So that's why they decided to do the elective C-section to take out the baby.
It was a peculiar case from the rest because the patient is an elderly nulip. When I say an elderly nulip, it means that she's a bit advanced in age before getting pregnant. And so, and she was due at the referral site. And so that means that labor could set in at any time. So we received her, we admitted and started monitoring in conjunction with the obstetrics and gynecology team. Upon review, we realized that her pregnancy had been complicated with fibroids, multiple uterine fibroids. And so that is one major reason people can advance in age without giving birth early. And so that makes her a patient at high risk. We say she is at high risk pregnancy. The obstetrics and gynecology team have to have their experts, the consultants, come in to see and assess. And then, because she is elderly, her management will have to be interventional. So we decided that we would have to have a cesarean section for her. The COVID-19 management team collaborated with the obstetrics and gynecology team, and we managed alongside. However, the date we were expecting that COVID result would have come negative, we received the second result again and it was still positive. So we had no choice than to prepare and go in with the COVID-19 infection prevention protocols in mind. So that's what we did. And that is why this case is very novel. It's the first time of its kind in the country, and we're so happy we are the center that produced this excellent result.
We did it under spinal anesthesia to take away any having to intubate, putting down a tube and all that, which is more invasive. So we used a less invasive but equally effective method. So she was awake while the surgery was done, and we saw her baby after the baby came out as well. And it also gave a lot of, it reduced the pain that she would have experienced if we had done general anesthesia. So she didn't have a lot of pain after the whole procedure. This really taught us that it was possible to do the operations on COVID patients successfully without you overexposing yourself.
Studies have shown that babies don't get infected. COVID is not a death sentence. No, once you get COVID and you report on time, the necessary things are done for you. Those who get complications are those with underlying conditions. 5% of COVID cases become severe. About 80% are mild. So there's no fear.
After seeing my baby, gives me a little bit of strength. But with COVID, you can never circumvent the symptoms. Thank you to Dr. Emmanuel Adepa and Dr. Dazi, the head of the surgery, and then to the nurses. They're really doing very well. And to my family as well.
Since she returned from theater, she hasn't been on oxygen. So it means she's practically recovered. And the operation was successful. So we all left here around 10 p.m. because we wanted to see what would be the outcome. So while they discharged her by the obstetrician gynecologist, we also discharged her from our center.